TBI, where we aim to bring successful startups and listen to their inspiring stories towards success and learn from them. So, as I've already mentioned, today we have Miss Shruti Babu, who is also a successful entrepreneur, a successful innovator from KIT TBI. So, over to you, ma'am. But before that, I just request every one of you to please turn on your cameras so that we can take a quick screenshot and then we shall proceed. Thank you so much, everyone. Ms. Shruti, you can start. Thank you.
Thank you, Team KTBI, for a warm welcome and introduction about Sahayata and also a short journey of ours. So, good morning, everyone. So, it was a warm welcome meeting you all today. Uh, a bright day where we are going to talk about my journey and also beyond grants. That was the topic given for me today to take it over. So, let me also throw some perspectives like what I think about the grants, beyond grants, and what we did in Dhanvantri Biomedical. That would be the whole picture and few inputs and do's and don'ts what I'll be sharing today with all of you. I think it's a close group of 31 people today in this meeting. So please unmute yourself, throw some questions. Let's take this as an interactive session as well. So yeah, cool. If someone is like willing to switch on their videos, that will be great. If not, also it's fine. So let me begin. Like we started from a SIP journey. SIP is a social innovation immersion program from KTBI. It's a BIRAC fellowship, and we started without a company registration, without an idea. But the best part is through this fellowship, we got to see there are a lot of problems, there are a lot of unmet need which has to be met. And being a biomedical engineer, I thought I took few problems or the unmet need from the market where I got to immerse myself, note it down in the complete chart, and with the help of mentorship, I was able to take the particular idea called mobility impairment. So when we talk about the mobility impairment, of course, Sahayata is our hero product. Before coming to Sahayata, throwing some limelight about the unmet need and how do we found the unmet need. So when I was like going and searching for a problem in different hospitals, in different old age homes, why? Because the theme given was geriatric. Aging and elderly was a specific fellowship theme over that year of 2018. So when I went there, I got to see a immobile person was suffering to go to his washroom. So I thought, why not as a biomedical engineer, I could assist him with some sort of device, with some sort of assistive aid. So that's how I got to see this is not only a problem of a small group, it's a global problem where the locomotive disability, which shows 3 crore in India, as per the statistical report of Indian disability. And globally, it's much, much higher as we have an aging population. So I thought to develop something which will be bed, which will be wheelchair, which will got a lot of features. You know, as a innovators, we all will try to do the same, but it was a great failure for me to attempt all the things. It looked weird, a kind of a robot. I got to learn, okay, in one step, we should give a simplified solution for the customer such that the customer will also understand, see, this is the problem I'm facing. And this can be the best possible solution which can take me out of the problem which I'm facing. So in our case, the customer who himself was not aware, this is the problem he is facing. Then he was crying, he was asking for help, he was losing his dignity while washing his body after defecation or after passing urine. So that's where we pitched in and we curated the product in such a way in an already available medical device such as wheelchair. We incorporated the cleaning system. Sahayata is one such wheelchair in the world which has got a cleaning system inside. So that's how we came up from the ideation stage to prototype stage, and now we are in the market and we have a paying customer. I'll tell you how it all happened. So I explained you to the prototype stage where we like literally failed many times, and it was not a one big shot. We have did an iterations about 118. We kept failing, and the best part in my life in this journey as a social innovator, I would like to highlight the best part was the failure. In each and every failure of developing a prototype, we got to know, see, this is not the right way to go. This is not the right way to approach. And there we curated the patents. Now we have filed a patent of design patents, utility patents in India, trademarks, and all. Not only in India, we have all patents which is being published in US, and we have been filed a PCT covering 140 countries as well. So few are granted, few are still in the processing. And this is the best part. During the failure, we got to know what is there in the world which has been existing, and how incremental innovation we can add to the current market, which has the business viability. That's what I just wanted to like highlight here. We can develop or we can come up with anything as a innovators in general. That phase we can try it out with grants. When we are stepping inside the market, then we have to go beyond the grants, which will be angel investing or taking loans, bootstrapping maybe. So these are some of the ways which we should. This is my personal perspective in which we worked out. Again, it depends upon the product and as well as the research what you're doing. So in our case, until we are entering the market, it was purely upon the grants. Till the ideation, we have SIP grant, so which was 5 lakhs, and we also had a stipend paid up to like 50,000 rupees per month. After prototyping to validation stage, we have BIG, Biotechnology Ignition Grant, again from BIRAC, where we got to validate how our product is, do some clinical validation, do some certifications. Can we enter this market or not? Before launching any kind of medical device, there are a set of validation which is to be done. So we got this done through BIG grant, which is of 50 lakhs. So this 50 lakhs really helped us again to fail and come back with all the certifications on place. So in the clinical validation, I would like to highlight, see, there are a lot of wants, needs. I would like to like elaborate in both. Wants are like, as a social innovator, I thought, okay, my device will do set of question of this. My device will be bed, my device will be wheelchair, my device will have a cleaning system, and many such things. And what the customer wants, we got to see in the clinical trials. When we give a wheelchair to be utilized, the customer said, see, yes, ये सारा feature ना हम लोग को नहीं चाहिए. We had a questionnaire on place. We had a questionnaire where the customer can define these are some of the features we want, and these are some of the features it's been never been utilized. So in that case, we were able to remove the features which were not being utilized and add up some features which were of their need. So after that, we went to a market entry point where we got another set of grant called Nidhi for COVID, which is to enter the market by diluting 100 devices of Sahayata in the market. So see, when we are going with a grant, of course, it's a free money, but again, it is as it is making things easier. We have to gear up with the operation. We cannot wait to sell 100 products as we got a grant, because the duration was for 20 months. So again, the pitching happened. Again, we went and pitched in various platforms. The investors found there is some business viability, but still we have to show there is a market traction as well. See, in every angel investing or every fund beyond the grant, whatever you're going or looking forward to, there needs to be some market traction where we have to show to any partners who are ready to invest to us. In that point, of course, Nidhi for COVID, which really helped us, and we were able to sell close to like 50, 60 units, and of course the next is history, like we got into Shark Tank, but trust me, we were not that confident like we'll be going to like get through the deal. But yeah, of course we made it. We got a 5 shark deal over there, and investors are like very much supportive. We are getting a lot of insights and guidance from them as well. So yes, this is a short note from the grants to the investment part. uh, I think we'll take up the questions. Meanwhile, we'll also we'll discuss what is there. Yeah. Any questions?
Yes, Dr. Rajiv, please go ahead.
Yeah.
Oh, yeah, morning, Sruthi. It was really enlightening listening to your journey so far. That surely boost up our moral as well to go about our venture. Now the issue is that your product is a technology product, biotechnology product, right? But all products are not technically, I can say, technically sound, or maybe it involves technical. Like for us, we are actually keeping all kind of mechanical intervention to the zero, because we are promoting a sustainable product, the green product. So we are keeping like electricity to the minimum or zero. We are actually now we are featured in good market product as well, because of the this green product. Now, personally, what we are facing, that for technology products, grants and other options are a little bit more, I can say, not easy. I cannot say easy, but more accepted for the jury or for the grant body or for the investor as well. So, in your views, how to approach this, or maybe how to overcome this kind of situation for a non-technical product, I mean to say.
Got it, sir. So, in any case of non-technical product, what you can do is start with a bootstrapping money, because we don't have much options left here in terms of grant. See, grant are very much accessible to the person or the product, where we can show them physically. See, this is the product. Or else, what you can do, sir, you have muted yourself. You have muted yourself, sir. I'm not able to hear you.
Yeah, tell me.
Yeah.
Sorry. Yeah. Okay, I got it. But in general, our actually options are getting limited out of it. You can understand this buyback and other things we have already applied for, though for the Niti Aayog's life for lifestyle for environment, we have been selected for the final phase also. But again, on the final stage, it is actually getting disqualified because of this non-technical technical intervention. So
I got it, sir. So, another thing, as you were saying about your product, I understand there is some impact which you are trying to do, right? So, you can apply for the grants which the impact study or the analysis is more, such that you can take the impact report and then show for the next set of grants. There are grants in the BIRAC for the green energy as well. But the thing is, you have to show, see, this is what I'm trying to do with some impact. So only by then you will be able to move it forward.
no, thank you. We are actually gathering those kind of certification. Actually, it is very limited option of we have in India. Maybe in the Europe and other Western countries, it is so much green initiatives are there. The certification authorities are there, but in India, it is little bit limited.
You can
But
also apply for the global grants, sir. There are global grants if you can search. So if not in India, of course, there are a lot of impact grants which is available for the green energy, which you can directly apply. And there are a lot of opportunities. So as you already know, but
yeah,
keep trying for it.
thank you. Yeah, thank you.
Mr. Gaurav, you can go next.
Am I audible?
Yes, Gaurav, please.
Yeah, Shruti. So first of all, I would like to congratulate you that you have worked on such a noble cause. Uh, and I'm saying this because I know the agony of the immovable person if they are bedridden and facing difficulty defecating. Because my father is in such a situation, so I can understand the thought that behind your innovation. And my question is regarding the affordability of the product. So, as I told you that my father in such a situation, so I want to know how affordable is the product, because it is having so many features, and it would have taken a long time to develop, a long kind of a lot of grant as well being used. So how affordable is the product for a normal person to actually go and buy it?
Thanks, Gaurav, for this question. Much appreciated. So, when I talk about the affordability as an innovator to come up with a product like Sahayata, who is solving the noble cause for the global problem, I can make like XX like an MRP, which will not make any sense when it comes to the customer acquisition or the customer buying it in the market, in the reality when I talk about. So during the clinical
Mhm.
trial phase, we got to understand what is the price which the customer is okay to pay
Mhm.
in the questionnaire, which I said you. Along with the features list, we also had a pricing range 30 to 40,000, 40 to 50,000, 60 to 70,000. What is the customer wishing to pay for such kind of product? Which actually like helped us in deriving the MRP of Sahayata. So currently we have two products, Sahayata 100 and 200 model. In 100 model, we have a recline feature, that is
Okay.
the stretcher feature with a cleaning system. And 200 model, again, we have a cleaning system, but it cannot be made into stretcher. So how did we arrive with the MRP? One is through the questionnaire. Second is through the, what to say, the manufacturing cost and so many costs altogether. And as a social enterprise, our what to say, we don't believe in profitability, we believe on impact. So considering the impact also, we got to finalize the MRP. So S100 model, which is 40,000 rupees MRP, and S200 model, which is 30,000 MRP. So the one who is not willing to pay 40,000 rupees because he
Mhm.
cannot afford it, what are we doing for him? So we have two ranges. One is the, we give them as an EMI options, such that it won't
Okay.
be a lot of burden for him to give a one shot payment of 40,000 rupees. Second, depending upon the class, depending upon his affordability level, we also subsidize the product. The subsidized product will be accessible by the set of information after getting it from the family or from the patients who are willing to order. We have a subsidizing partner, a CSR partner. For
Mhm.
example, there is a person who is willing to pay only 20,000 rupees, depending upon his financial stability when we talk about. What will
Yep.
happen? There is another 20,000 which is being left. So we have a CSR partner who will be sponsoring 20,000 rupees for him after getting and validating a set of proofs, set of income proofs, set of certificates. For example, one of his family member is ill and they are getting sahayata. What is the medical condition? Are they really will be creating impact if they are sponsoring 20,000 rupees in such kind of patients? So these are some of the things we make it and make the customers feel, yeah, this is the problem we are facing, and without any second thoughts, they come forward and purchase it from us. It can be 5,000 rupees, it can be 10,000 rupees. We get the set of documents clarified, certified, then we give an access of CSR funding. So to highlight, we have also provided without getting any money from the patients. Like so many wheelchairs of Sahayata has been deployed in CSR funding as well.
Okay.
Yeah. And there are a lot of patients who say, see, 40,000 rupees is not a money for me. Along with 40,000 rupees, I would like to pay 10,000 extra, such that please give it back if someone is facing shortage.
Mhm. Okay.
So That's how we work.
Yeah, great. So that answers my question.
Yeah.
And the second thing is about the maintainability, because these kind of electronic devices needs regular maintenance. So do you provide support for engineering support and all that in case an issue comes up?
Yes. So for Sahayata product, we provide a warranty of 1 year.
Mm-hmm.
1 year, it's a replacement warranty for the cleaning system. What if some kind of services occurring inside 1 year will replace it? After 1 year, we have a chain of network. So these all, what I'm saying, have been developed during the pipeline. When we got inside Tamil Nadu, we had some service member biomedical engineers who will be going to their home for the service, who will be like saying, yeah, there are some of the friends who is nearby to the station. Through the chain of chain, the service, that is the main point, will be finalized and will be attended in kind of any service call. It is to be attended within 3 to 5 days. That's how we have planned. And fortunately, we have been not getting any kind of service call, because there are a lot of quality tests we do in house before like dispatching one single product.
Mm-hmm. Okay. Yep. So I'll be probably contacting you offline then.
Sure, Gaurav, looking forward to.
Yeah. Thank you, Shruti.
Hello,
Thank you.
hello, hello, ma'am.
Yes, yes, sir.
Yeah, is I am audible?
You're audible, but I'm
Yeah,
no one. Yes, sir.
no, actually, I'm in traveling, ma'am, in train.
Okay.
Okay, ma'am. First of all, I have congratulations for your success. Hello, ma'am. Can you tell what type of certificates your product has and where you are approaching for the certifications like that?
Yes, Pavan. So, would like to answer your question. Let me put it this way: are you working in medical device?
No, no, ma'am. We are in the sensor manufacturing device.
Okay. So, how does it relevant about the certifications?
Like we are NTPL certificates. We are thinking and IO certificates like that. Recently, we got the BIRAC fund
Okay.
2022. So we have to work on that also. So actually, I want to know what type of approaches we have to go for the certification structure.
Got it. So, maybe I have to like take a deep depth into the product in which you're working. For us, the certification were more upon the wheelchair certifications, which has been already specified like ISO, ISI, CE, as we have an electronic components inside it. So these three are the must certifications before we were entering. So we got it done that way.
Can I know, ma'am, how to where we have to approach for the certificates like that?
So it depends. See, for me, it was all about money. Okay, so I can
Okay,
hire a consultant if I have 10 lakh rupees for a single certification. I cannot hire a consultant if I have only 1 lakh budget on the month left. So that is a game which you have to decide. Are you going through the straight ISO certifications? Are you keeping some consultant in between? And how much budget do you have? And you
okay,
can also straightly research like how do you apply for ISO certification. It's a time taking process as well, and there are a lot of applications and the data works which needs to be done. Learning that process and doing the certification would be the, what to say, it would be a headache. So what we have done is, I have done the basic part. I actually convinced the consultant who was charging 5 lakhs to 10 lakhs. I convinced him, see, so we don't have that much money. We are a normal startup and we have only this much budget. At the end, what he'll be saying, he'll be doing or he'll be not doing. Let's find out and consultant in the budget what we have. That would be the right pathway, along with some of the knowledge. See, some of the consultants who are charging 5 lakhs or 10 lakhs, you should be aware what are you trying to do and what is the output you need. According to that, if you throw some light to the consultant, see, do this, and I'll take care of this part. So you have to also learn about the certification part. Make sure what your consultant is doing to oversee. So that's how we worked out.
is there any additional charges? Is there, ma'am, like that government charges like that apart from
Of course, your
consultants?
see, consultant is just for applying. getting it or not getting it, there needs to be some verification which will be from the government side. That you have to pay.
Ma'am, what is the timelines for the ISO and ISI certificates like that?
Timeline as upon your application drafting, it depends upon which date you're applying. Again, when you're paying the government fees, there will be some allocation of the government agents who will be coming to your office, checking the ISO of the product as well as the office. So due diligence literally takes time. So for us, it was around 90 days.
Okay, fine. Thank you, ma'am.
Thank you, Mr. Pavan. We can now take Madhulika ma'am's questions. Madhulika ma'am, you can unmute yourself.
Thank you. Okay, first of all, I'd like to congratulate Madam for such a good cause you have innovated, and I have seen your, Shark Tank journey, and it has really fascinated me. So, actually, I would like to know, can you throw more light on your Shark Tank journey? How did it started? What are the procedures and stages that you have gone through before coming to the real show?
Okay, so let me tell you, before Shark Tank, we had little presence in the market. For us to apply for the Shark Tank, there were two reasons. One is for the money. Again, is to give a shout out to the world. There is some product existing in Coimbatore, or we are developing some product called Sahayata from Dhanvantri to address such problem. These were the two reasons why to go for the Shark Tank for us. And when season two came in, for me it was my husband to like push me down and say, see, you really have to go and apply for it. So I had some doubt because we were not that working that in the market. We were supplying only to few hospitals in Coimbatore where we are from. So there were no sales at all. As in the big numbers, we were doing some sales, but not that great. So I said, see, coming in Shark Tank, it's like telling about the sales, telling about the revenue, this and that. How are we going to perform? We don't have anything in a larger picture to show the investors. So he said, why don't you give a try? Then we gave a try in filling in the application. Season 2 started with an application form. There are two steps of applications. So we filled in both. We got a call stating that there's a audition in Mumbai. So we went to Mumbai along with the product. So in this, let me tell you the having a difficulty of having a physical problem, physical product. So we had a very huge wheelchair, right? We have to take it. एवरीवेयर वी यूज्ड टू टेक इट. हम लोग ना ट्रेन में जा पाएंगे ना बस पे. हम लोग को कोरियर करना पड़ेगा पहला. वी हैव टू मेक श्योर इट रीचेस इन द राइट टाइम. उसके बाद हम लोग को ये देखना पड़ेगा कोई तोड़ फोड़ के तो नहीं आया है, सही आया है क्या. So these were few things we made sure of. So we went there, we assembled it because we were a very small team. Now we have, of course, we are also hiring now. We have also grown very much higher from the team size perspective. Before it was a close team of 5 to 6 members. So traveling, we had a budget. Everything that were a constraint. Traveling budget was only little, so only one person was able to travel. So myself traveled to Mumbai for giving an audition. So I was sitting and like assembling the wheelchairs, jobs, everything. People were saying, okay, this girl has come all the way to Mumbai, so why don't we give a chance? Because I was not able to pitch in Hindi. Hindi was the major factor because we are getting it telecast in the Sony television. I said, see, I'm from Coimbatore. I won't be able to give a Hindi pitch, but definitely I think you should hear from a, what to say, an English pitch or something like that. So I gave a pitch and they really liked the product. That's how we again got selected for the final round where we pitch in front of the sharks. And before that, going and pitching to the sharks, we had a thoroughly, what to say, mentoring session from the Shark Tank team as well. How to pitch, what to say, what not to say, how to stand, all the mentoring support they gave us, how to brand ourselves. So what is the gesture you have to like place. So these are some of the support which actually like mentored us very well. When we go and stand in front of the shark, we got an aura of confidence like, okay, come on, we can do that. So that's how everything happened. And of course, after Shark Tank, when we highlight, so our team size has grown now. We are now a team of like 10 to 15 members. There is a few salespersons also the team. Before I am the only salesperson for my team. I go and brand in every hospital. I carry wheelchair, uh, and I go and explain, demonstrate to the hospital doctors. Now we have salesperson. Now we also have a team who's sitting there in Delhi for the sales and rest of the things. If I'm stuck somewhere, I have a support. So I still have a support, of course, from KTBI directors, Mrityunjay Swar. So now I have a support from Amit Jain, who is accessible in WhatsApp. So such a big person who is accessible in WhatsApp means a lot to us. It gives an emotional strength. भाई देख लेंगे, कुछ भी होगा तो देख लेंगे. We have a support system. So that is also a big thing. Apart from that, the sales. So it really is a goosebump moments for me when I talk about sales. Before it was an unpaid orders. Okay, so we have to go and pitch in every hospital. They used to compare with the normal wheelchair. They said लेकिन भगा देते थे हम लोग को. नहीं तो बोलते थे कि ओके लेट्स कीप वन प्रोडक्ट एज ट्रायल्स, और वो एक प्रोडक्ट ना कभी हम लोग को वापस नहीं मिलता था. बोल देता था कि ये सैंपल प्रोडक्ट है, मतलब कभी भी लेना है तो लेके जा सकते हैं, और हम लोग लेके भी नहीं जा सकते थे. तो इट वाज लिटरली अनपेड ऑर्डर्स व्हाट वी वर गेटिंग. बहुत मुश्किल से पेड ऑर्डर मिलता था. उसके बाद अभी जो शार्क टैंक जो आई स्टिल रिमेम्बर हम लोग का एयरिंग डेट था मार्च 8 को. उस दिन से ना वी kept getting paid orders website से. The kind of credibility we got it from the Shark Tank was enormous. Within 2 days everything got sold out. We had a stock to 100 to like 300 units. Everything got sold out. मतलब पूरा pipeline बढ़ाना. The next set of issues or the next set of planning which started. चलो प्रोडक्ट बना लिया, मार्केट में तो मार्केट एंट्री तो कर दिया, सेल्स भी हो रहा है. व्हाट इज द नेक्स्ट? टीम बढ़ाना है, सर्विस चेन निकालना है, डिलीवरी पार्टनर्स ढूंढना है, कॉस्ट इफेक्टिव ऑपरेशंस बनाना है. ये सारा चीज ना इट टेक्स टाइम. ये पाइपलाइन में है. एक साथ सारा मतलब इशू सॉर्ट करना इट्स नॉट पॉसिबल. जब हम फेस में प्रॉब्लम फेस करेंगे ना अपने आप वो भी सॉल्व करने का. I think that's the main role of entrepreneurship we all have. So it will go on, but I think it's a wonderful experience. Madhuleka ma'am, thank you for the question, and it was a sweet memory to cherish again in this talk.
Thank you. Thank you, ma'am. So much fascinating and so much wonderful journey you have. And secondly, I just wanted to ask you one thing actually. We are a startup supported by Kitty BI through this BIDAC grant. So we are developing an contrast agent for MRI. So we are concerning the limitations of the conventional contrast agents which are in the present market. So now we are at the end stage of this present grant. So as you have told that we are in the immediate need of a second grant or such like that, an amount of money for clinical trial for all those validations and the certifications before going to the market. So in this case, I just wanted to ask you, what is your suggestion? Should I means many things we are trying like VC, then angel investors. So can you think we can go for Shark Tank journey in this stage, or should we go only with a viable product in the market?
So so it's again your call, ma'am, but definitely my perspective in showing the pathway would be you can try for it. Shark Tank, because it's both for the idea as well as the well marketed or the sales product. But I would recommend you to apply for the SIPRI because हम लोग को ये पता, मैम, we are not we have started things from a very scratch. We understand because जब BIG खत्म हुआ ना मैम, हम लोग को बहुत डर लगता था हम लोग नेक्स्ट क्या करेंगे. जब भी एक ग्रांट खत्म होता है ना, इनोवेटर्स को बहुत डर लगता है कि हम लोग नेक्स्ट क्या करेंगे, नेक्स्ट कौन सा ग्रांट उठाएंगे, वो आते आते कितना टाइम लगेगा. वो ड्यूरेशन है ना जो टर्न अराउंड टाइम फॉर द गेटिंग नेक्स्ट मनी, इट्स वेरी वेरी डिप्रेस्ड. We are continuously thinking about it. So I completely understand because हम लोग को भी ऐसा एक फेस था after BIG. हम लोग निधि for COVID में of course select हुए, but keep in mind that see, there are so many grants, we can get through those grants. How much time duration will it take to get the money? We have to literally keep 8 to 10 months of time duration before we are like applying for the next grant. Before 8 months, we have to apply and get things ready. चलो ये खत्म होते ही हम लोग को नेक्स्ट सेट ऑफ ग्रांट अंदर आ जाएगी. दिस वी गॉट टू अंडरस्टैंड ओनली आफ्टर बीआईजी. हम लोग फंस गए थे बीच में. तो इन नेक्स्ट फेज मतलब बिफोर निधि फॉर कोविड मनी वाज गेटिंग ओवर, वी वर थ्रू शार्क टैंक, वी वर थ्रू नेक्स्ट सेट ऑफ ग्रांट्स. तो ऐसे ही मतलब ऑपरेट करना पड़ेगा टू मेक आवर सेल्फ सस्टेनेबल, नहीं तो टीम बिगड़ जाएगी. So in this way, I would highly recommend you to apply for सिब्री. Take two options. अगर शार्क टैंक नहीं मिलेगी तो सिब्री है हाथ में, अगर सिब्री नहीं मिलेगी तो शार्क टैंक हाथ में. दोनों नहीं मिल जाते तो हम लोग नेक्स्ट कैसे सर्वाइव करेंगे? That I want you to think. Maybe bootstrapping चलो अच्छा है, bootstrapping अभी फिलहाल नहीं हो सकते, तो एंजल ठीक है, institutional funds ठीक है. It depends upon the company valuation as well, but make sure the funds flow is regular.
Okay, thank you very much, ma'am. We'll contact you later offline. Thank
Thanks, Madhurika ma'am.
Thanks, Madhulika ma'am, for your query. Anyone else want to go ahead with any questions? You're free to go. I don't think anyone is having any queries at this point now, ma'am, so you can continue.
Great. So we have another 7 minutes.
Right.
Yeah.
Yes, if anyone is having any doubts, please unmute yourself. No, I don't think.
Cool.
You
So
can continue.
wishing you all the best. Again, thanks for the opportunity to KTPI to interact with the highly motivated and like-minded people for the day. Thank you so much. Any questions? Please feel free to mail me shruti@sahayatahealthcare.com. Visit our website. Uh, let us know if we can do anything. Let us know how we can be a part of the impactful journey in which you are in. So wishing you all the best once again.
Thank you, Sruthi. Thank you.
Thank you so much, ma'am. Thank you so much for giving us
Thank you.
such a beautiful insight. For giving us such a beautiful insight of your journey as well. And since you spoke about the BIG, I will take just 2 minutes to let our innovators who have joined here know that the BIG 23rd call is now open. All you need to do first is, okay, ma'am, Nandini's ma'am is having a query. Ma'am, I'll just speak for 2 minutes and I'll be giving you the chance to speak. So we have our BIG 23rd call open right now. You can take the letter of intent from us. I am sharing the link in the chat box and you can go ahead with the application. In case if you want to know more about the application, we have a session today from 4 p.m. I'll be sharing the link also with you all. If you all are interested to join the session, please join the session. There you will be getting to know from one of our experts about how to go ahead with the proposal, how to make a proposal perfect and strong enough for you to get the grant. So this is a very good opportunity to kickstart your innovation, and BIG will definitely be a milestone in your pathway. So I request you all, the letter of intent link is provided in the chat box. You can please look into the chat box, and in case if you're having any queries, you can contact me. My contact number I'm providing in the chat box. So we will be there to help you out. The meeting link I'm sharing here in the chat box. Meanwhile, Nandini ma'am, you can go ahead with your query.
Hello, ma'am. Good morning.
Good morning, Nandini.
Ma'am, actually, I just have a question. Like, if any startup is going for a grant, so what are the main things they need to focus on, except pitch deck, fund utilization, and the projection they are making, financial projection? Like, what are the main things they need to focus on? Actually, I have seen so much startups. Like, there is a Startup India seed funding scheme. provided by the government. So I have seen like they are rejecting the funding. Like the reasons are like there is no uniqueness, no competitor is there, your fund allocation is not proper. So I just need to ask where we need to focus on that part.
So, Nandini, what are you building? If you can throw some light about your idea or something like that.
Actually, ma'am, I actually work in a company where we help startups basically in making their pitch decks. So that I have seen that like many of them are getting their application rejected. The same question is there, like uniqueness and the competitor. Only these two. And like they are doing very good things. They actually go to the one round also, but then the application got rejected. No proper guidance is there, like you need to focus on that. Only rejection mark is there. They just don't guide like you need to focus on this area and then you can resubmit your application in that way. So I just need to ask where we are missing that point. Where we need to focus on any, like suppose if we go for an education sector, like there is one startup who is creating storytelling. She's using storytelling process for housewives and homemade girls which are working in home, so that they can teach students by telling stories instead of providing the book language like definitions and all like that.
Got it. So, Nandini, first of all, I don't know in which application they have rejected. So, what we can do is we can ask for the feedback. In which point have they found the application not work in proceeding ahead with the next step? And second, I guess KTPI is a great platform for all of the innovators who can come in for the mentoring session, such that the percentage of the failure would be much, much lesser. And of course, if we are failing, let's work towards the what to say, the technology part or to the innovation part, where the focus is very much higher in terms of funding. In terms of funding, rather than doing some service or doing some technology related product, it again differs. So it depends upon the application and the funding scheme in which you're trying. So it should be very, very specific. If it's related to technology, then of course there are set of technology grants where you can apply. Or if it depends upon some of the impact of the service or some of the apps, where there are next set of what to say, the grants where you have to go and pitch in. So first point is the technology innovation. How are we different? So what are the innovators? Why they are being rejected is, see, I'll tell you my story. During our initial phase, when we went and we thought we are okay to go in front of the investors, we said our wheelchair is the best wheelchair. Sahaita is going to be a robot of next version. We failed. We literally failed. We've asked for only 10 lakh rupees. We failed. It was in the year 2022. So we failed. We were wondering why. We did not get any feedback. We went and approached next set of investors where we got some feedback. They said, see, these are some of the points where you have to work in. So we worked on and we reverted back in a much powerful way. So that we really have to understand, and we would like to also highlight the platform where we are going and pitching in. Before knowing what is going to happen, we should finalize, okay, this will be the platform or the pathway for me, such that the quantitative results would be this much. So some of the analysis also should be done, but of course KTPI will be able to help you much better with all the feedbacks, I guess. Yeah, Nandini?
Yes, ma'am. And can you also help me in tell like what are the things we need to focus on if we are making the fund utilization? Suppose it is for 20 lakh grant. So mainly for first time the grant is only for the prototype development we get. So like most of the fund should only goes to the technology part, like portal part, or we can use it for the our like manpower also.
See, it depends on the project. If you're building an app, then the manpower would be more. If you're building a technology related product, then the outsourcing would be more. The manpower would be less. So I would be able to suggest, if you're like able to give me some sort of idea or some sort of project in which you're working, it will again depends upon that.
Okay, I mean to say like there should not be any question like if they will ask like you are taking a grant and you are using all of the grant in your manpower only.
We
Why
should
you
not
are
do
not using in?
We should not do that. The grant is specifically to assist us, not to draw salaries.
Okay, ma'am. Okay, ma'am. Thank you so much. Thank you so much for your guidance.
So I would also like to give a short note about the BIG. So we got to apply on the BIG call 14. Only because of that we were able to give a transitional phase from the ideation stage to the prototype and series of prototypes, and also the filing of patent, which really paid off us in patent granting, or a lot of patents was filed during the BIG grant. So BIG for us had been a fantastic phase of our journey, where we had a space to fail, we had a space to research, we had a space to innovate, we also had a space to like protect our innovation by filing patents and also take it for the clinical studies. So I highly recommend all of you to apply for the BIG grant. Yeah.
Thank you so much, Ms. Shruti. Ms. Nandini, thank you so much for your queries. If anyone else is having any other thing to ask or clarify, you are welcome to do so. I don't think anyone is having any queries to ask.
I guess Nandini have raised her hand again.
No,
So
she has not lowered her hand actually.
okay, no problem.
Okay.
Thank you. Thanks, Kitty BI. Thank you.
Thank you so much,
Thank you.
ma'am, for your
Thank you,
timing.
Shruti.
And I have shared the meeting link for today's meeting at 4 p.m. about the BIG proposal, the link to generate the letter of intent, and also the link to join our WhatsApp group. So you can click on that, get join, be a part of our WhatsApp group so that you get all the updates about the BIG 23.
Adrija, actually, this link is not working. I have tried already.
Which link is not working, sir?
This WhatsApp group, I have tried to join 2 times, but it did not allow me. It is actually it is actually coming back to the same pace. It's not happening actually.
But I think it's for me, it is
Maybe
open WhatsApp. So can you please check once again that whether it is working or not, or else I'll send it to you in the mail if it is okay.
yeah, absolutely fine.
Okay. Thank you so much, everyone. Thank you for joining. I hope you had a good session today, and we look forward to have more such sessions in the days to come. So please stay tuned with us. Thank you.
Thank you.